Okay, I think I've given people enough time to join us. So I just want to say hello to our viewers who are joining us virtually, and of course to our panelists who have joined us as well. We really appreciate you taking the time to take part in this evening's panel. My name is Shannon Handy. I am a reporter for CBS News 8. I do a series called The Learning Curve, and it's a franchise that we started several months ago when the pandemic started. Essentially, we wanted to really focus on stories based on education and how kids are being impacted by COVID, because as we all know, there are families all over the country dealing with this when it comes to kids and COVID and getting them back into the classroom. So I really want to thank our experts. We have a great lineup of them, and I really hope that this helps educate parents, staff, and teachers, and whoever else is watching. So the idea for this panel came from the Cajon Valley Union School District. Dr. David Miyashiro, the superintendent, is here with us. And so I just want to toss it over to you, David, to talk more about this panel.
Thank you, Shannon. Thank you, CBS 8, for hosting tonight. Our county superintendent, Dr. Paul Gothold, with us tonight, convenes the 42 school district superintendents every Friday, and we've been doing this since March. And he brings to us resources, he lobbies for us at the state and federal level. But what he also does is bring to us experts. So Dr. Pong and Dr. Bradley and Vice President of Operations from Rady Children's Hospital, we've been able to hear from them in our county superintendent meetings about new findings, mitigation, safety practices, and also what we're learning about the spread of the virus. Stephan, our district attorney, has been a huge champion to help advocate for our children here. And what we wanted to do is to, with the help of 9th District PTA, California CSBA, and California Public Health, speak to our parents and our teachers and school staff directly, so they have the same information that we have as we open our districts to send their children back to school and to make decisions about their workplace. And so thank you all for joining us. And Paul, thank you so much for leading us and being our champion and for bringing these resources to us superintendents and now for our greater population today. And welcome, Dr. Paul Gothold. And the #1 phrase, unmute yourself.
Thank you, Dr. Miyashiro. And it's great to be in the presence of a strong partner at the District Attorney Stephan, and everything you do to support our children and work with us to improve services for our kids, and our partners at Rady's Hospital that we've been working closely with, for the past 6-7 months, more closely than ever, I should say. And really our role as a County Office of Education is support of all 42 districts, 167 charter schools and now many private schools, and trying to navigate these difficult times. And as a father of 2 children, I will tell you this has had quite a strain and not been easy. And quite frankly, we're blessed and fortunate to be part of the lucky ones that, can do this without both parents working. And I know a lot of our families don't have that opportunity. And my heart goes out to everyone who's suffering through this time, and just know that we're doing whatever it takes to help our families and kids. So thank you.
Thank you, Dr. Gothold. And of course, we heard about Stephan and the work that you're doing. We talk a lot about testing and getting kids back in the classroom, but what your office has focused on is kids' safety at home. So can you talk about your role in this?
Yes, and it's just terrific to join this amazing panel, and thank you for all that you do. This is an important conversation, and in San Diego County, as the district attorney, I have jurisdiction over all the school districts. We are the entire county, and we look at public safety, whether it's threats to schools from school shootings or whatever it may be. The pandemic brought another threat to our kids, a really huge threat that no one was really talking about as we discussed COVID. And it is the violence and trauma, child abuse, exploitation, the increased in human trafficking, in runaways that we've seen since the stay-at-home orders. And it was really important that I share this publicly so that the harm from COVID is weighed alongside the harm from staying home for our kids with regard to their health and their safety.
Thank you, Summer. And I want to also thank Barb Ryan, who helped connect us with the Rady team. She's a school board member in Santee that helped facilitate this. Chris Abe is the Vice President of Operations at Rady Children's Hospital. Chris, would you please introduce your team and also a little bit about the work and what you're seeing from your perspective?
Absolutely, thank you. I'm Chris Abe, Vice President of Operations here at Rady's. Nurse by background, have been doing infection control and disaster management for about 35 years. So you put a pandemic in my hands and, you know, I used to think it was going to be really exciting. Now I'm really ready for it to be over. But we've been working here at Rady's in being part of the team that really advocates for children of San Diego County. We all have the same mission, making sure that they're healthy, safe, and they get the education and the things they need. On our panel, and we've been working together, well, for years, but for this pandemic, I have Dr. John Bradley, who's the medical director of our infectious disease program and an infectious disease physician, and Dr. Alice Pong, who's the medical director of infection control and also our hospital epidemiologist. So we've been the team that have been leading the Rady COVID pandemic response, and we received our first potential patients back in January 30th with the expatriates that came into Miramar. So we've been doing this a long time, and what we can bring tonight is lessons learned from taking care of kids with COVID and how we've prevented spread throughout the hospital and how to keep the kids and the employees safe. So we're very thrilled to be here. Thank you.
Thank you. So lots of the questions are going to be directed at your team. For example, how likely are children to catch and transmit COVID-19 at school? Is it safe for school employees to be in close proximity with the students? Should children play together at recess? And should they wear their mask when they're outside? And a lot of these questions you're going to answer in a short rapid fire presentation. So we're going to turn it back over to you and start with what you're hearing from your perspective and what parents and school employees need to know about coming back to school.
Great, thank you. And we are going to bring a quick slide presentation up. And we want you to know that the questions that your faculty and your families have are very similar to the ones that our staff and our physicians' families have. We all have kids. So this is our opportunity to share that information, and we'll go quickly so we get the questions and answers. I turn it over to Dr. Bradley.
Great, quickly. So first of all, it's a privilege. It's been really rewarding working with everybody on behalf of children and the families to get the kids back to school safely. And this collaboration is going to make it work. There's no single answer for every child in every school, but we know all the pieces of the puzzle that need to be there in order to get kids back safely and protect the teachers. And we're going to share much of that this evening. So a short presentation here. This just gives the cases in San Diego that are reported by the county. This is just in a format to show you by month what the number of cases by age group have been. And you can see things were fairly calm in June. We flattened the curve, and then in July 4th, we thought it was over, and everyone started to stop masking and congregate. Big peaks. And we made a big effort to close things back down again and educate about the importance of mask and distancing. And then by the end of August, we were making great progress. And then as Labor Day hit and some of the colleges came back, we saw big spikes like San Diego State University, which represents a large amount of the 20 to 29-year-olds and the 10 to 19-year-olds. And now things are going back to normal, or at least a level that is sustainable and controllable. Next slide, please. The question about kids getting the infection and data from Europe, from the very beginning of COVID that spread there first, suggests that children are less likely to get the infection from adults than adults are from other adults. And this is just information that looks at 32 different studies on transmission. And what I've done in the red blocks to show you that for children and adolescents, I've circled the fact that children are much less likely to be a case following contact than adult is after contact. So we don't know why kids are less likely to be infected. It's just an observation. We're working on figuring it out, maybe many different factors. But I want to point out that the rates of kids getting infected after a contact vary everywhere from 0% to 20%. So when someone says, will a child get it in school? I can say, well, if they're sitting next to someone and they don't have masks, the rate is somewhere between 0 to 20%. And these are the most current, best data we've got. The vaccine. It's very clear that we're not going to get herd immunity, meaning that virtually everyone in the population will be immune from natural infection. And we're going to have to rely on vaccines. There's incredible progress in vaccines. And this was published by one of the Health and Human Services specialists, Nicole Lurie, that shows how rapidly the vaccines are being developed and funded. And just to bring us into October, the fact that the 3 fastest vaccine programs are actually nearing completion. The one that's being done, well, there's a couple, but one of them that UCSD is participating in, the Moderna NIH vaccine, will finish enrollment at 30,000 patients by next Friday. So half of them get vaccine, half get placebo, and we don't know which is which. There's a booster dose they'll get 28 days later, all of them. And then we track how well the vaccine works. So it actually looks like by early December, we will have information to the FDA about vaccine efficacy. But the trials for children won't start until all the data in adults have been reviewed and the vaccines are considered safe and effective. So we'll all be immunized before the children will be. And that's actually okay because of some of the slides that I'll show you about the disease process in just a minute. And this just shows, this is from the World Health Organization, tracks global vaccine. And there were 38 candidate vaccines a few weeks ago. There's 42 now if you go on their website. But I just wanted to let you know how vigorous globally the vaccine programs are, not just the United States, but Europe, China, everywhere, India, everyone's making vaccines. And no vaccine will be used in the United States unless the FDA reviews the data and the vaccines are safe and effective. Great. So, Alice, there was one slide on mortality that I just wanted to bring up. In San Diego County and across the United States, deaths from coronavirus occur mostly in those who are 60 years and above. But the vast majority of cases that are documented are in those who are under 60 years of age. Kids do really, really well with this particular infection. As a matter of fact, 50% of them have no symptoms at all. And no one would have believed this 2-3 months ago. So you don't know in a classroom which kid has infection and which kid doesn't, because they can have absolutely no symptoms. And the symptoms vary from nothing to a little bit of sore throat and congestion to very rare pneumonia. And we've only hospitalized a handful of kids since January with active coronavirus infection. So we're protecting the parents and the grandparents of these kids because we don't want them bringing the infection home and spreading it to susceptible adults. Sorry.
And I would just need to say with all of that, even if you don't know if they are infected or not, the use of the mask prevents the transmission.
Yes, it does.
And the other mitigating factors, which we'll talk about.
Thank you.
So as we talk about opening schools back up, the whole issue of closing schools was done to protect the physical health of children, teachers, families, and society in general. However, that needs to be balanced against all these other measures that we're losing because schools are closed. So the educational needs of children, the social and emotional health of children and their families, economic needs because parents can't go to work if their kids aren't in school, nutritional services and child protective services that were mentioned earlier are all part of things that happen in school and reasons why we have to get kids back. So when we talk about transmission of this virus, the bottom line is that this virus is, for the most part, transmitted through large respiratory droplets. going from one person to another person through close contact. It enters through the nose, eyes, or the mouth. And you can put it into your eye from your hands by rubbing your eye or scratching your nose. You can also get it through, so therefore you can get it through contact with secretions and self-inoculation. Children are less contagious than adults, and we've seen that in a number of different studies. Adolescents, however, are similar to adults in size and the forcefulness of their cough. And so their transmission rates are more likely to be like adults than little kids. So the mask is one of the most important things that we use to decrease transmission. It decreases spread of the virus from people who are infected because it keeps your secretions contained. It also decreases the amount of virus for the person who's wearing a mask to protect them from other people who might be coughing without a mask. It decreases the amount of virus that you're exposed to. It also prevents you from involuntarily touching your nose and your mouth. And this is something we've been doing in the hospital for years, and we've been telling our staff that if you wear a mask, it's going to protect you in a number of different ways. So there's a number of mitigation measures in addition to masking that we think are really important. And in the hospital, we use something called bundles where we have multiple different things. No one thing alone is going to prevent transmission, but if you use enough of these separate things, they all contribute to preventing transmission. So social distancing, that helps you keep apart from people who are sick. Use of outdoor spaces, we encourage this as much as possible. In San Diego, we're lucky to be able to do this more than they actually are in other parts of the country. Use of physical barriers, these can be used at desks, they can be used during lunchtime. Hand hygiene is so important, not only for COVID, but for every other virus. Cohorting decreases the number of children that are exposed to any one person. And therefore, if you do have someone who comes down with COVID, you've got a smaller group of people that are secondarily exposed. Screening for symptoms is important. You don't want anyone who's sick to enter the school arena in the first place. And then cleaning high-touch surfaces. And then finally, testing. Especially testing symptomatic students and staff. This is how we're going to find the people who are infected, find them early, and decrease transmission.
And I just want to touch on the social distancing. We keep hearing and talking about 6 feet, and 6 feet is really ideal in what we want to do. There are times you can't do that, so you use one of the other elements of the bundle. You use your mask, you use your good hand hygiene, you use those to be able to prevent the transmission, and it works. So in a hospital setting, if we're rounding in an ICU, we can't, with all the doctors, stay 6 feet apart. So what we do is we make sure they wear the mask when they go in the rooms. We make sure they wear eye protection. In the schools, it's the same concept. What are the other pieces you can do when you don't have 6 feet and when you can do it safely?
Okay, so this is the algorithm, the decision tree that's been disseminated out to the schools and how to keep students and staff safe. It's a very complicated decision tree that's somewhat hard sometimes to understand. So I tried to put it into a table to make it a little easier. So basically, if you have a symptomatic student or a staff member, you can either be, if you're COVID positive, then you're out for a minimum of 10 days from the onset of your symptoms, or 24 hours being afebrile and having your symptoms improve. If you're symptomatic and you get a test and the test is negative, you need to stay home until your symptoms are resolved for 72 hours. If you're not symptomatic, but you are exposed to someone for COVID-19 and you get a test for whatever reason and it's positive, you may be one of these asymptomatic or pre-symptomatic people. You are again out for a minimum of 10 days from the positive test or from the onset of your symptoms. And it's the same rules of having your symptoms be improved and not having any fever. Now, if you're exposed and you either didn't get a test or you are negative on your test, you still have to be off for 14 days from that last exposure, because it's a 14-day incubation period where any time during those 14 days, you could develop symptoms and become contagious. So no matter whether you get a test or even if it's negative, you need to be out for 14 days.
But the key here is what the exposure is. So it's a low risk exposure. So you're with somebody who's COVID positive, but you both wear your mask.
Yep.
You do not need to be quarantined. if you meet all the CDC requirements. So I think that definition is really important for people to understand what the exposure means.
Right. And so this is a little harder in school sometimes, because knowing whether or not the person was wearing a mask or whether you are always wearing your mask is really hard. I think it's, for the most part, they're going to err on the side of saying if you're less than 6 feet from the person for more than 15 minutes, that's going to be considered an exposure. Now, a question that keeps coming up is, what about the household contacts to the person who was exposed? Do those kids have to be taken out of school as well? And the answer is no. If you're a contact to a contact, so you're the sibling of a kid who was exposed at school, if that person who was exposed does not get sick and has not test positive, those siblings of that child do not need to stay home from school and do not need to be tested.
So what happens out of school is important as what's in school. We say that to our staff all the time, is you can't just follow the rules at the hospital and then go to parties. So we really need to do this consistently. Go to the next slide. So what the lessons that we've learned here in taking care of kids with COVID and working with staff is, and doing all the research, is transmission from children is low. The children seem to be less susceptible and less contagious than adults. So there's a lot of good information about that. Mitigation strategies work, but it's not just one, as we've said, and we're going to keep saying that. We're going to keep repeating that as we have this conversation tonight. Transmission events occur more often in the household and non-work or school exposures right now. So our staff who are out are not out for work-related exposure. They're out because they've either been out doing something without following the guidelines, or it's been with a family member who's been exposed. So we've taken care of over 1,000 patients with COVID at Rady's. We've had zero transmission. We've had nobody come down sick. One of the things we do is we do a lot of testing of our staff, not only with PCR when they're symptomatic or they've had an exposure. We also do the serology testing to see if they had the disease and they have antibodies for it. And we've gone through our high-risk areas like the emergency department and our units that actually care for the kids with COVID, and we're not seeing transmission. So we're confident in using these mitigation strategies, and we believe very much that they will work in schools also. Got to have universal masking, social distancing, hand hygiene. You got to do all of these things in different pieces, and you need to have the culture of saying don't come to work or school sick, and keep people who are symptomatic out. So that screening up front is important. So again, wear the mask, social distancing, hand hygiene. But during the pandemic, there are other things that we really encourage for actually everybody, adults and for kids. Maintain routine health care. People have been scared to go to the hospitals. Don't be afraid. See your physician, do the health care you need. You can do some of it virtually, but you want to make sure you do that. Maintain immunizations, huge. And we know that there have all been all sorts of different infectious diseases have rebounded because people haven't gotten immunizations around the world. Stay connected with family and friends. You need that, the mental health, to feel healthy and connected with your family and friends. You can do it virtually. We're in a good age for a lot of this. Eat healthy and get a lot of rest. And we believe all of these things that we've learned as being a pediatric organization will also help the learning as we open schools. Thank you for letting us give a little information.
Thank you. Yes.
No, thank you, Rady. Well, we're not done with you. There's some questions that we have, so we'll bring you back. But Shannon, why don't you take over?
Yeah, thank you guys so much. It was a lot of great information. Like David said, we'll get back to you with some questions we have from viewers and parents. Well, I want to jump over to Summer Stephan. We talk a lot about kids in the classroom and their health. You're in charge of the public safety of the entire county. So what have you seen as far as the impact to children's safety during this pandemic, specifically with schools being closed?
Yeah, I've seen a very dramatic and alarming rise in internet crimes against children. And that's really understandable because kids are on their tablets at a very young age, on their phones. They're away from school. There's no one monitoring. Kids are Parents are trying, but there's many parents who have to work outside the home. And so this means that children are being victimized by internet predators. The National Center for Missing and Exploited Children reported actually intercepting predators talking about how opportune this time is to get to our kids. In San Diego, we have a robust effort prioritizing kids, an Internet Crimes Against Children task force. As an example, in the month of May, the numbers quadrupled. We normally have about 140 cases of Internet crimes against children. We had over 600. In the nation, that's the same relation, about 4 million reports as opposed to 1 million. And Rady's did an excellent presentation and referred to the numbers. And in their numbers, they have a specialized team that looks at child abuse when it's suspected. The numbers went up by 82% of suspected child abuse. And so this basically keeps me up at night, knowing that while we're thinking that our kids are safe from the pandemic by keeping them home, they're actually very unsafe physically, emotionally, and those harms can impact them for a lifetime.
You, in fact, Summer, you wrote the governor a letter about this because, as we all know, a lot of these decisions when it comes to reopening schools really starts at the state level with the governor and then kind of goes down from there. So can you talk about that letter that you wrote to him?
Yes, I wrote a 7-page letter to the governor, and that's because I felt that San Diego, we are very proud in law enforcement that we are data-driven. Working with the 9 police chiefs and sheriff, we track data because we are the safest urban county in America because we prioritize public safety and we know our numbers. And so we had these numbers. We knew that the internet crimes against children have gone up, that human trafficking cases as to minors running away have gone up, child abuse has gone up, and that reporting has gone down, which is alarming. And so in the letter, I tracked all of this data for the governor, and I recommended that as we measure the safety and the harm to our children due to disease like COVID, we need to also counterbalance it with the safety of the trauma of child abuse that has impacts that last a lifetime.
That's sad to hear about, but thank you so much for the work you're doing on behalf of all our children. David, I'm going to give it back over to you.
Yeah, and our superintendents and our counselors especially know these things are happening and have been trying to reopen. Paul, what is the county's role in reopening our schools?
Yeah, we are basically here to provide support, service, guidance. When it comes to opening schools, it is the complete and total discretion of the local district and board. And I will tell you that in addition to all of the things that we've heard here, we've, as you know, been providing infection rates by zip codes so we can look at the local data and context around that, and all of the other variables to open schools safely and keep our kids and staff safe. And as you've seen our guidance, it really depicts how to do this. And again, we have the insight and intermediary role of interpreting some of the rules and regs as they continually change almost every week. And these tier systems, which is also brand new. But at the end of the day, we do not have the jurisdiction to open and close schools. That rests exclusively with districts.
So the guidelines and the rules constantly change and they're vague at best. Timeline-wise, what are some of the key milestones for schools since campus closed from March to prevent the spread? And then what are schools and districts working on now to reopen? What does that look like?
Yeah, it just a snapshot. So when you think about this, when schools closed to prevent the spread in March, and we still are learning more about the disease every day, as you know, as the health officials know better than I. The doctor in front of my name gives me absolutely no license to practice medicine or epidemiology, so I'm just disclosing that up front. And then in June, we got remember the local health order to say now you can reopen schools if you construct a safe reopening plan. And then shortly thereafter in July, we got the edict from the governor that no, you need to stay in distance learning. You cannot open schools. And then just shortly after that, 3 weeks, we're off the watch list. Then we're going back to this tier system and 10 days from that. So, we've had to be nimble, flexible, and it's really hard to communicate when those conditions have conditionally changed. The cohort guidance recently changed. And then on September 17th, we were this close to moving back to purple, and really the edict there was that no, if you haven't reopened, you cannot do so. So fortunately, we're still in red, and we have the flexibility to continue reopening. And that's just one example of how we've had to navigate not only the conditions, but the health orders and everything else.
All right. Thank you so much, Paul. We want to make sure we get to some questions. We have a lot coming in from parents and from staff. So we're going to address each of you individually, and then we can have an ongoing discussion. Summer, I do want to go back to what you just said, because on our Facebook Live, there's some questions coming in. Maybe you can offer some clarification. If CPS cases have dropped, how did child abuse rise by such a high percentage? This was a question from David Hernandez, and he has some other people chiming in. So maybe you can clarify that a bit more.
Yeah, that's a great question. And it's because it is the teachers, the counselors at schools that have eyes and ears and are mandated reporters. That's the frontline people that are protecting our kids from abuse and reporting it. The kids are not able to get that benefit. And Dr. Gothold and I have twice written letters recommending that teachers still take time on distance learning, trying to eyeball their kids and see if there's changes, if there's something wrong. But we know that is so difficult to do. And so the numbers have gone down by about 40%, and that's a dramatic decrease for reporting. But we know for a fact that crimes have gone up through the tracking of data from the Internet Crimes Against Children that does automatic platform tracking through tips of children being exposed to child pornography, to sexualization, to improper images being asked of them by predators. So we know it's happening. We also know that from the Human Trafficking Task Force that we've got more minors that are trapped in sex trafficking, that are being lured away from their home to a party or to something innocuous that turns into a situation they cannot control. So the two actually make a lot of sense with what we're seeing with COVID and with staying at home.
We know that the school is the safest place for kids to be during the school year and also during the summer. And Paul, in your former district in Linwood, in Cajon Valley, about 70% of our children are in free and reduced lunch and struggling below the poverty line. We also have a large affluent community, but some of our children that are making ends meet at home, they act up right before summer break. They act up right before spring break because they know that they're not going to have access to that safe place at school. And now that we've been out for so long, it's really hard. And so as districts struggle to come back, the questions about safety are about, well, should 6 feet be the rule or 3 feet? And we're getting caught up in some of the safety issues. Should kids wear their masks all the time? Is it okay for them to take off their mask when they're at recess? These are some of the parent questions coming in. And specifically from Audrey, as a parent, I'd like to ask this panel, is it really necessary for children to wear masks when they're at their desks surrounded by a barrier? Why can they not bring backpacks to lunch or school? And if nobody touches them, do kids need to be our kids need to be in-person learning? So to Rady team, this parent is struggling on the mask issue. Can we start there?
So we'd start with the yes, you do need to wear the mask. And we know that it is difficult, but you get used to it. We require a mask for all of our workplace employees. And part of it is and especially children can get distracted. And when you don't have it on, and then all of a sudden you get in an exposure risk, you may not put it on when you need to. So wearing it consistently is the safety factor that's really going to make a difference. Agree with that 100%. That's that is probably the number one thing that is going to help keep rates down and transmission down in the schools. It's a really good question about the backpacks and the lunch bags, and where are the risks there? And I'm gonna say my answer, and then we may get something a little bit different. But I think the transmission risk there is lower. What you really need to do is make sure the hands are washed, and you need good sanitizer. The alcohol does take care of the virus. That's your bigger concern, is making sure the kids then don't, after they touch anything, whether it's what they're bringing in or the surfaces, they don't touch their eyes, nose, or mouth.
I think what you want to do is you want to minimize the number of things that kids are bringing to school. My daughter's actually back in school, and she wants to put everything in her backpack. And I'm like, no, all you're going to take in your backpack is your lunch and your water bottle. That is it. That's all you're going to take, and don't bring anything back home. You try to work with the teacher to do as much of the coursework that can be done through Zoom or through through computers that way, so you're not bringing home tablets and papers and all these types of things. So you want to try to minimize the number of things that are actually being brought in.
And teach them to wipe it down. Frequently, even adult workspaces in the offices, we want to have more of attention to those surfaces. Wipeable, cleanable products.
And the less stuff that they bring to school and that the teachers end up touching, then the less risk there is to teachers. But if the teachers do hand gel after touching handbags and lunch bags or whatever, then it decreases the risk to the teachers and other school workers.
And I would just add to what the Rady's folks said, Dr. Miyashiro, there's actually no statewide or county-wide mandate on bringing, backpacks or lunch boxes to school. And actually, the one thing that is in the CDPH guidance that is a non-negotiable is wearing masks. That is the one thing that's in the guidance that says you must for grades 3 through 12.
Let's stay there, Paul. So a lot of the questions are, well, if this district is doing that, why doesn't the other district do that? And you and I know that the answer to this question, but for everyone else, why don't all districts just use the same plan and the same rules and the same class size? Why isn't it that easy?
Well, I think a lot of it has to do with the fact that they don't want to be overly prescriptive and give you the opportunity as local districts to make those local decisions. I mean, a lot of what we do in California is based on local control. I mean, our funding formula is even called that, local control accountability. But I think that, when it comes to, number of kids, the best we could do was under the assumptions, what is your school going to look like with 30% of kids on campus, 50% of kids on campus, social distancing, masks, hand washing and sanitization. So these are the things that we continuously talk about. And the question about, 6 feet, I think that if you're 5 or 4 feet, like the folks said, I mean, as long as you're adhering to the spirit and the intent of the law, we've even heard this from our county folks, that's not a deal breaker. Bringing all 3,000 kids on one campus is not advisable. But if you develop cohorts and if you do an AM and PM session and break up the amount of kids on campus at the same time, and you're limiting to the best of your ability class sizes when you can, you're following the spirit and intent of the health guidelines, and I think that's what is expected of us.
And Dr. Miyashiro and Shannon, I want to add that I had a conversation today to get the latest from the county on this issue on school reopening. And Gary Johnston is our lead resilience officer, and they stand ready to help all the schools with their reopening plans. The good news is they've prioritized testing for teachers, school staff, and for kids. This is the newest thing, that kids 5 and above will get tested. And the county has prioritized that and will make it accessible. So that is an additional benefit. And from my part, again, coming from a family of educators with much respect to them and understanding the risks to them, that their heart is with these kids. And what's important is to really understand the detrimental effects, and the detrimental effects to our kids that are pretty heartbreaking. And kids from lower socioeconomic, even more so. I hear from parents all the time, distance learning is not working for them. They can't teach their kids. They don't have the same internet. They're not able to do pods. They can't get tutors. Their parents may not have the education level to help their kids. These are all big things that our county has to put all of the harms together and, at least in my mind, have a reopening plan. Have that in good conscience, and then move forward step by step with the experts. I'm not the expert on COVID. I'm the public safety expert, and I stand ready to help them in any way I can.
You know, Summer, I want to stay on that point regarding access to testing. I think it's great that the county is going to open that up, because I did a story about this recently, and this is for the Rady's team. With cold and flu season right now and the restrictions in place at schools that are open, we know that if your child has a sniffle, they go home and you have to go through, you know, the testing or the 10 days. I actually dealt with that with my own daughter recently. So can you talk about the fact that we really can't tell the difference between cold, flu, and COVID testing? And what do families need to know about testing, since there's going to be a lot of kids that need to go in for these tests?
Well, from my part, what I heard from our county team, our county health team, is that they understand what a ripple effect the school closures have on everything, on life, on parents being able to put food on the table, get jobs, kids' welfare in terms of public safety, because I'm constantly hammering about that. And so the rules are much more relaxed, meaning they're not, in the beginning when we didn't have the testing capacity, you really had to show those symptoms that are COVID symptoms and also be in a high risk group. That is no longer the case. The testing has become a lot more available, a lot more expensive, with prioritizing the schools and the kids, not like before where they prioritized the over 60 with health risks and other things. So the test, treat, and trace is a large team now with the county, and they're working very closely with the schools and everybody to provide that service.
And Summer, if I may add to that, you know, the benefit we do have in this county with our Board of Supervisors actually providing this is unprecedented. I mean, there are not many counties that are saying we're going to go ahead and test all school employees for the remainder of the year. We have over 80,000 school employees in San Diego County. And what the guidance says now is 50% of your staff, once you're open, needs to be tested each month, or 100% every 2 months. So in addition to the 40 testing sites we now have available throughout the county, there are 4 now dedicated centers exclusively for school employees to test. So it is a big deal in this county that they've made that commitment, that Live Well and our Health and Human Services have really stepped up and shown they're committed to K-12 education.
And Dr. Pong, you and I actually discussed this today regarding the cold and flu season. Specifically, a staff member named Jennifer asked, with the upcoming cold and flu season, we need more info about symptoms. So just tell the panel what we had discussed today.
Right. So between COVID-19 and all the other respiratory viruses, the symptoms are essentially the same. You cannot tell by looking at a kid with a runny nose and a cough whether they have COVID-19 or whether they have influenza or rhinovirus. So they need to be tested. And I'm glad to hear that the county is stepping up and expanding testing, and they're going to be doing regular testing as staff. We're ramped up to help with the pediatric population and to trying to set up some additional sites so that it's easy for kids to go and get tested. It's going to make a huge difference whether they're out for 10 days or whether they're out for 3 days. So it is a big deal, and we're doing everything we can to help with that effort.
And I think, you know, we talked about, it's been mentioned a couple times, it's a fluid situation, things are changing, technology, testing, all of that. What we spent this morning with a key group of physicians laying out the algorithm of when the patient comes in through the ED, do they get COVID flu test because there's new testing coming out that you can do both at the same time? Do they get a panel that has all the other respiratory viruses? I mean, those are some clinical decisions that need to be made. to be able to make some determinations on the care of the kids. For the schools, it's really making sure that you're able to say it's not COVID and say it timely so they're not out 10 days. And or to say it is so that you can look at then and say, what are the other kids that were exposed?
Yep.
And how do you prevent more transmission so that you can continue to keep the schools open? So having very available testing is a huge piece. And San Diego County has done a fabulous job in trying to make sure that those tests are available and the sites are, and we're continuing to try to be a big part of that.
The other good thing about all these mitigation measures, though, that we're doing, they're going to work to prevent other viruses as well as COVID-19. So hopefully we're anticipating that we're going to see less flu this year because the kids and everybody else are social distancing and wearing masks. We will hopefully see less of those respiratory illnesses than we normally do during the winter.
Thank you.
And Shannon, one more thing I was updated on today was that there have been schools that are open, and there has not been an outbreak related to schools opening yet. So that means the schools are doing their safe reopening plans, and it's very positive.
Okay.
Yeah, on that, Paul, you oversee all of us, and all of us engage with you. There are about 10 districts right now that are open to in-person learning. What are you seeing in those 10 districts in terms of the early results? And then also for those that are in the process, what is that process and why should parents be a little bit patient as they try to open?
Well, I think for everything that we've talked about, it's a very complex issue. And I can tell you that superintendents are doing the best they can, and that all of these factors are on the table, they're being discussed, and everybody's in a different place for different reasons. And, you know, one of the things that that when we talk about, you know, there hasn't been an outbreak, to my colleague's point, that what we brought up today, you know, I've seen a district that one kid was in contact with someone who tested positive. They, at an abundance of caution, put that classroom in 14-day quarantine. They shut the classroom down. They pivoted to distance learning by, you know, mid-morning, and 14 days later, the kids were back in school without incident. So the only incidents that we've seen just happened to be because of contact with others who had COVID, and we responded appropriately. County Health is the first call, and in some cases, that's the call to the district if those are the particulars.
And Paul, can you actually clarify, because I'm monitoring our Facebook Live page, and people were questioning the statement made about no outbreaks at school. So just clarify that, because we know that students may have got COVID from elsewhere. And in fact, David, you had mentioned to me earlier this week that that's happened in your own district. But when it comes to outbreaks within the school, students getting other students sick with COVID, can someone on the panel clarify that?
To my knowledge, there has not been a spread inside the school, meaning an outbreak in the school, community transmission at the school. That's what I understand from County Health. The kids that have tested positive or others was a result of contact outside of school, in which case the school responded by either closing the classroom for 2 weeks. So that would be something we would explore further with Dr. Wooten and her staff, but I have not heard of any outbreak in our schools.
Okay, thank you for clarifying that. I know it was something people are curious about. And again, Summer, again, I'm monitoring our Facebook page, and people keep going back to what you were talking regarding the abuse cases. So what can the public do to help? Because you did mention that when children are out of school, they don't have the teachers to be able to report for them when they notice abuse. So what can the public do to help if kids aren't in school and there's all these abuse cases?
Well, we'd want parents to really learn to have more knowledge about what their kids are doing on their computers, on their phones. We want them to ask questions, to explain directly to kids these issues about the person posing as a friend that may not be a friend. These are direct conversations that must be had with the kids. We want neighbors and anybody, grandparents, whoever comes in contact with the child, to be extra alert, to ask questions, to see changes in behavior. kids usually blame themselves and feel ashamed that they shared an improper photo or that something happened. And it's very important to talk to them about it. Those are all interim solutions to make sure that we safeguard our kids. But kids really need that normality of the trusted adults in their life. They need their sports, they need their faith places, everything that gives that kid the support system to build a village around them. But parents, they can go to SanDiegoDA.com. We have a whole COVID page specific to the safety of kids, internet safety, so that in the interim, parents are having these healthy conversations. One thing parents should not do is threaten to take the phone away, because then the kids will not share anything with them. They should establish the trust of saying, I'm not going to take your phone away, but if you share with me what is happening, and never allow a code, a passcode that the parent doesn't know about, because after all, you own the phone and there is no privacy rights there, then you will allow that child to keep the phone so long as the trust goes both ways.
This is a medical question. There's a lot of fear of people watching CNN all day long and never leaving the house. But we've been learning a lot of things about treatment. For the Rady team, what have we learned about treating COVID patients, about convalescent plasma, overcoming the virus, kids coming in with the virus testing positive? What are we learning in terms of positivity rate versus morbidity rate and progress?
So great question. For kids, we use the same drug that is used for adults that President Trump got, remdesivir. We're doing the clinical trials in children right now, but we have so few kids who actually come in and need oxygen that we're waiting for kids to come in to get enrolled, which is really good for the kids. Adults, as you know, if they have an oxygen need, are eligible to get remdesivir. It's actually available, comes through the county health department and then to the hospitals. There's no oral therapy yet. Hydroxychloroquine does not work. Those data are out. But for someone that comes in with serious pneumonia, an adult, dexamethasone, like the president got, that works. That's now standard of care. And there are probably 5 different experimental agents, including the antibodies that the president got. That's just one of many different experimental therapies that show a lot of promise, both in animals and primates where they test. So we've got a lot of information on how to treat. So someone coming into the hospital now, an adult, an older person, someone with underlying disease, actually has a really good chance of making it through. So treatment is there. What we're learning is that most people, even adults, have just minimal disease. And as we do more testing, and there's a contact exposure, someone with symptomatic disease who exposes 20 people, we're finding out that most of those 20, even if they're adults, have no symptoms. So we're finding that those in the hospital are just at the tip of the iceberg, that most of the transmission are in people who are minimally or not symptomatic at all. But we do have treatment, David.
That's interesting. One of the other concerns is community spread. So what are the likelihood that children will get COVID at school? And what is the likelihood that a child, symptomatic or asymptomatic, will spread or create an outbreak in the community?
We're worried about that. I'm not going to sugarcoat that. And especially kids who have no symptoms, which represent the majority of them, can be spreading infection amongst themselves and within their families. The rate of spread from children to other children, especially in schools, is remarkably low. We don't understand it. And these data come in from all over the world. They're reproducible. So if there is a child who turns up positive in the school, spread is actually going to be minimal, if at all. And I don't understand it, but I'm really grateful that that's a reproducible fact. But we worry more about kids bringing it into the home and spreading it. And there's also a potential for school workers, adult school workers, to pick it up from the kids if they don't wear their masks and do hand washing and a bit of distancing. So
even though we're worried about it, we
Yeah.
do know that those mitigating factors work.
yes,
We've also, there's lots of really good studies internationally that show that a positive student in the classroom is not spreading it through. So
right.
there is lots of really good data about that the spread with school-age students in classes is not high,
Right.
Right.
including to teachers.
Right. And in our own hospital, we have lots of healthcare workers who are taking care of sick kids. And the kids are not wearing masks in most of these rooms. And we have had very little, if any, I don't think we've actually had any transmission from a patient to a healthcare worker. The healthcare workers who we've had who've gotten sick all got it at home or some other social event outside of work.
So while we're worried, it's not a big enough worry to keep kids from going to school, and we can track it. And if there is an outbreak, as Dr. Gothold mentioned, we'll find it. The county will test, we'll close down that cohort of kids that get exposed, and we'll prevent spread.
Right. And the important thing is the mask and all the mitigation measures, and that will keep you safe.
Well, it encourages me that you're sitting 3 feet apart and you have your face coverings on and are not concerned because you're bundling and doing all the right things. So a classroom of children sitting with barriers and face coverings, we can do this safely as long as we make sure we're following the guidelines. Paul,
Yes.
some final thoughts before we close up the topic?
I'm sorry, who do you want?
My stubborn mute.
Okay.
I just appreciate the opportunity to be here today and to share information and talk with folks who are doing this day to day. And I do want to acknowledge the fact that I know this is difficult and some of the data points are certainly troubling. But just know that we have some of the most vulnerable kids in this county. For those of you who don't know, we have programs and services specifically for foster homeless. We educate children in our juvenile halls and community schools and do that faithfully and honorably. And we're willing to do whatever it takes to make sure our kids are safe. And we also know that this is temporary. This is going to get behind us at some point, and we'll be better and stronger on the other end. And we'll do whatever it takes to support our 42 districts and work side by side with our critical partners to protect our kids. So thank you.
Thank you. Summer?
Thank you to everyone. Summer, did you have any final thoughts before we end this panel?
Oh, it's an honor to be with you, and for anybody out there that needs any help with anything, please reach out to the DA's office. Our team will respond to you. And we love our children. We want to be there, and we want to make sure that they're safe and healthy.
Yeah, we all want that. And I know that this conversation could go on all night, but we just blocked out an hour for this. And if we didn't get to people's questions, I apologize, there just isn't enough time. But this is an ongoing conversation, as we all know. So us, the media, and I know all of you officials will keep this conversation going and try to answer people's questions. If anyone wants to watch this panel, if you tuned in the middle of it, at the end, it will live on our CVS State YouTube page, our website, cvsstate.com, as well as our Facebook page. So again, I really appreciate all of you joining us tonight, and to the Cajon Union Valley School District for coming up with this idea to put this panel together. As David said today, he hears from all of you weekly, but the public doesn't get this access. So I think it was really interesting for them to see how this all works and the type of information we share weekly.
Just one final comment. This is really hard work. So for the Cajon Valley employees and parents that are listening, and all those that are working to open up schools, thank you for doing that. We've heard over and over from parents that when they pick up their kids on that first day, that I saw my child for the first time in 6 months. They came, they told me about their day, what they ate, who they saw, what they played, what they worked on. And the work is truly #heroes work here. Thank you all for working so hard. And for those teaching distance learning, that's not easy either. And Shannon, thank you for hosting this and for News 8. And maybe we can make this somewhat of a a more frequent thing.
I would love that. Thank you all. Have a good evening.
Thanks, everybody.
Thank you.
Thank you.